My name is Lucy Winstanley. I'm Head of Patient Safety and Quality at West Suffolk NHS Foundation Trust.
What was it about PSIRF that interested you?
I think we definitely saw the opportunity for change. We had been struggling, as many had, under the serious incident framework to produce a quantity of investigations with very little change as a result. So we felt very fortunate to be put forward as early adopters of PSIRF. We really relished the opportunity to think differently, to certainly as an organisation think about what was important to us for safety and quality and how investigation could help support us on our journey.
How important is board and ICB engagement?
We were fortunate that our board was very engaged from the off. They also had the appetite for change. They wanted to make sure that we were doing the right things for our patients, and that started with safety and quality. So we've been very fortunate, and I think it has been very much part of our success that we have had that support to be flexible in our approach, because that is the big difference with PSIRF. We were part of a region of early adopters with other organisations and also our commissioners, so learning together has been really beneficial.
How did you develop your patient safety incident response plan?
Our plan for us was the document that was going to govern us, essentially, as we entered into the framework. So we did a lot of look back, we did a lot of collation of incidents that told us what we thought we already knew. So for us, using key stakeholders, so our divisional leads, our safety and quality partners, was really beneficial, because actually what we wanted was to triangulate all the information we had. So not just incident data, but also what were our colleagues in our patient experience team telling us? What did they know from the volume of complaints or PALS inquiries they had had? What were our learning from deaths team? What was their focus that they wanted to help drive change? We started with a small group that grew and we engaged through a task and finish approach. When we just did the initial look back on our incident system to see what we were flagging as incidents, they were, I think, what many acute providers would see. So we had high volumes of falls and pressure ulcers, which lots would, because we naturally report them well. But actually it was the ability to use that information with what we were hearing from the ground that was really beneficial. And what we hope to continue to achieve through PSIRF is taking on some of the more complex and bigger safety issues that you wouldn't necessarily see if you just used a data trawl.
What have been the challenges and successes so far?
The biggest challenge is the flexibility around it, particularly if you are from a risk and governance background. You're used to having stability. As part of our plan, we looked at our resources and realised that we spent a lot of time undertaking a quantity of investigations that weren't particularly of high quality. So we did recruit bespoke patient safety incident investigators as part of our journey. They have really added a wealth of not only experience, but also the ability to have a different approach. So in terms of our staff and our patients, we feel that they are much better engaged in the processes because we have the skilled investigators who are able to support them through it.
Has PSIRF influenced safety culture?
I wanted PSIRF to feel different. That was my main aim when I started to implement this plan. This isn't something that one person does. This is a team approach. This is a whole organisation approach, trying to engage a better culture, a sense of safety, a sense of being able to talk openly around when incidents happen. So I think there has been a change, and I can feel that change. And in terms of our patients as well, it does feel that we are much better engaged with them when things go wrong.
What advice would you give to others preparing to transition to PSIRF?
It's a different mindset. You have to approach it as a collective with the freedom to know that you are making a change and doing it for the right reason. So that flexibility, that appetite for change has to be the driver when you step onto this programme, because it is very different from what you know already. And there will be questions and there will be grey areas, but as a collective, if you are confident about your approach, keeping your patients at the heart of what you're doing, I think it will be successful.
To find out more, visit our website.